Okay, hi everyone. This is Terry Sheffield, and welcome to our Wednesday night Akea call. You guys know the drill. Just about every Wednesday what we do, or not just about, but every Wednesday what we do is some form of call or webinar, and we try to bring you, exciting and good information that you can pass along to others. Tonight, I think, is probably going to be one of our best calls because we have an incredible gentleman here with us tonight that's going to talk to us about how quality nutrition can prevent and support treatment of terminal disease and support a healthy immune system. So let me just tell you a little bit about Dr. Gordon Koltis before I turn the call over. Dr. Koltis is certified by the American Board of Radiology and Radiation Oncology and by the National Board of Medical Examiners. He also has the distinction of being a fellow of the American College of Radiation and Oncology. In addition to that, he also serves as the chairman of the Department of Radiation Oncology at the Lenore Memorial Hospital Cancer Center, and is the medical director at the Carolina Radiation Medical Center Medical Cancer Treatment Center. Guys, his long experience with radiation cancer treatment and his, and the availability that he has to state-of-the-art technology at the Carolina Radiation Medicine Cancer Treatment Center serves to offer patients some of the best possible radiation cancer treatment in the U.S. Guys, we're very, very fortunate to have with us here a member of our Science Advisory Board member, Dr. Gordon Koltis. Dr. Koltis, are you with us here tonight?
I am. Are you able to hear me?
I got you loud and clear. It's fantastic to have you on the line. And so, Doctor, I'm just going to basically, I want to turn it over to you. Just want to let you talk a little bit about, some of the things we discussed earlier today. At the national event we did here in Raleigh, you talked about, how people can treat cancer and prevent cancer and all that kind of thing. Can you expand upon that tonight with us and tell us just a little bit about what people probably want to know the most? What are the things they can do in their daily lives that really can give them the best opportunity to avoid cancer?
Yes, and I appreciate the opportunity to address the folks who have joined in tonight. Well, let me first say that as an oncologist, and specifically a radiation oncologist, actively practicing in that field for 28 years, and actually some of those titles I have since passed on in the past couple of years, but certainly was in those positions for over 20 years. We realize as patients who come to me with the diagnosis of cancer are facing a terrible dilemma, and to try to deal with how am I going to get through this. And actually, I don't, topic-wise, I'd like to clarify, I don't like to think of this as a terminal disease because, in fact, we cure many patients of cancer. So it is a potentially fatal disease, but our goal, of course, is to cure people of cancer. And as I had gone further and further into my practice treating patients, one thing that became clear to me after repeatedly being asked, well, doc, okay, I have breast cancer, I have colorectal cancer, I can't do my chemotherapy, I can't do my radiation therapy, I need you as doctors to do that. What can I do for myself to now help improve my chances of successfully beating the cancer that I have and being one of the people who's going to be cured? That is something that had been asked of me so many times that I made a specific effort to incorporate nutritional counseling and emphasis on nutrition, healthy mind, meditation, biofeedback, and physical activity. Those are all things that go into dealing with cancer treatment in addition to the conventional forms of therapy that we have. The supportive things, as I mentioned, nutrition could not be more important. One of the major problems with dealing with an individual with cancer is that their energy, their nutrition is essentially eaten up so that their healthy tissues and a healthy body is competing with cancer cells for the nutrients that are put into their system. And it requires excellent nutrition, intelligent nutrition, in order to not only deal with fighting cancer, building one's immunity, which will help prevent further cancer, and immunity that will help fight the cancer, but also to be able to give them every possible opportunity to get through the treatment and the side effects of the treatment. Any chemotherapy, any radiation therapy, of course, damages normal tissues, has certain side effects and such that makes it difficult to get through in many situations. We're successful at being able to do that, but cannot do that for the few minutes or a few hours that a patient or individual is in the clinic. So I have to take a look at what are the things that nutritionally have been shown to or either proven or suggested as being possible benefits in either preventing cancer, because I would like to not see people come into the clinic and say, with a diagnosis of cancer, what can we do to prevent it? We'll boil all this down to get away from the shark's tooth and the Laetrile and the this and that and various sorts of things which kind of come and go, that are sort of fads that people get onto nutritionally, and boil it down to what things that the American Cancer Society, the National Cancer Institute, multiple independent research companies, and many major universities and as such have done research on. And that comes down to nutrition and regular exercise. What is important about nutrition? We're going to talk about cancer prevention. Limiting excessive fat intake has always been a concern and has been shown to be an issue with respect to a decreasing risk of breast cancer, colorectal cancer. Then there has come onto the scene, what about taking antioxidants and various vitamins and the such. Vitamin C and vitamin E are antioxidants, but there has been controversy over excessive intake of things such as vitamin C and vitamin E, especially other antioxidants such as selenium. So people kind of get into the habit of going to the GNC and buying a bunch of minerals and antioxidants and vitamins, and hopefully these are things that are going to help them either get through their cancer treatment or prevent them from developing cancer if they're not somebody who's already developed one. The studies, by and large, have demonstrated that taking fractionated vitamins, vitamin A and vitamin C and selenium and all of these things, have not been shown to be beneficial. Part of the reason is because we're extrapolating from saying, well, but we get these things when we're eating foods. And what foods are the most important? Which people are the healthiest in the world? Which people live the longest? By and large, the people who live the longest and are the healthiest, in addition to incorporating healthy mind and routine daily physical activity, are those who are eating plant-based diets. Those are phytochemicals. Those are things that are derived from plants. Now, even though you eat a fruit or vegetable and it contains a vitamin C or contains various antioxidants, it's impossible for any research to break down specifically and say that that one particular component of that food, of that broccoli, of that kale, of the lettuce that you might eat, of the carrots or the tomatoes, the lycopene that you get from tomatoes, or whatever, that is the specific component. So the recommendation by the American Cancer Society, which is based on interpretation of multiple studies, is that 2.5 cups of fruits or vegetables per day, or if you will, 5 to 7 or 7 to 9 servings of fruits and vegetables does make a difference, has been shown to make a difference in the prevention of various cancers, including kidney cancer, lung cancer, prostate cancer, breast cancer, colorectal, throat and stomach. And the emphasis is on a whole food. Now, I look at a patient and I tell them the best thing that we know nutritionally that you can do for yourself and something that you have available to you is to eat 7 to 9, if you can. I'll accept 5 to 7 servings a day of fruits and vegetables. Well, if you're not feeling well and you're going through therapy, you're not likely to be able to take in very good meals and calories if you are having side effects. Not everybody has a side effect of nausea or poor appetite when they're going through treatment, of course. But I find that healthy people do not take in the recommended amount of fruits and vegetables during a day. So I have to take a look and say, well, what alternatives are there? The fractionated chemicals, antioxidants, and vitamins and minerals have been shown not to be beneficial. So we recommend that people eat things, as we would say, in the original package, which means eat fruits and vegetables. You can cook them. Don't overcook them. You can eat them raw. It becomes virtually impossible. I've asked this question at most of the meetings that we have, is have a show of hands how many people can eat 7 servings of fruits and vegetables a day. There's very few hands that go up, very few at 5, a few more at 3. Some people down even at 1 don't even their hands up. So I take a look at a product like Akea Essentials and the value of the fact that this is not something that is synthetic or artificial. It is actually a whole food. It is a food product. You remove the water, you remove the sugars, the fructoses, which are pretty typical in the fruits as a source of sugar. So the water, the salt, and the sugar is gone. All of the rest of the nutritional benefit of a whole food is left in that powder. That is the closest in my mind that we can possibly come to being able to offer people, not patients, don't want to think of as patients, but people who do not want to become cancer patients, myself included. That is the closest that I can come, or anybody else can come, to meeting the recommendation of the volume of fruits and vegetables that we know, without a doubt, have been shown to decrease the risk of developing certain types of cancers. There are many clinical studies that have shown a strong suggestion, without 100% positive proof, that something about those fruits and vegetables seem to be decreasing the risk of various other malignancies. So if I'm taking a look at that type of scientific evidence based on clinical trials, many of them substantial numbers of people who are entered into the trials done by reputable institutions, that taking in the nutritional value of those fruits and vegetables makes a world of difference, and is certainly going to give you the advantage, the possibility, and increase your chances of preventing you of developing a multitude of malignancies that might otherwise threaten your life. And Akea, in my assessment, currently is probably the most potent nutritionally, packed nutritionally, with the value of the whole foods of fruits and vegetables, of the products that are currently available on the market. I don't know all of them, but I know many of them, and I have dealt with several of them over the years. So when you take a look at the value of how the food nutrients work together, there's something about the fact that there's fiber, that there are antioxidants, that there are vitamins, and there are other compounds that are present in those fruits and vegetables that act together when you take them, that do not work the same when you take them on a fractionated or an isolated basis.
So, Dr. Koltis, I have a question for you. I mean, I think this is the clearest, most understandable way that I've ever heard, nutrients being taken. And I just have a quick question. I spent the majority of my career in the nutritional business working with what you're calling fractional vitamins or chemicals. And that's something I think that gives our consultants around the country, such an edge in, talking with people about various nutritional products. Can you go back and just expand upon what you mean by you've seen, or maybe you said that there's no real proof that these fractional vitamins or man-made synthetic chemicals have the effect that whole foods would have on someone. I just want to clarify that point and make sure everyone really gets what you're talking about, because as a radiation oncologist, I find this fascinating that you say you can take all if I can say it in layman's terms, you're saying you can take all the vitamins you want, but it's not going to have the effect as cultured whole foods. Is that correct? I mean, is that what you're saying?
That's absolutely correct. Now, I will temper that with, and let me just clarify, fractionated vitamins or fractional vitamins, but fractionated vitamins means you are taking something, whether it's a natural source or whether it's a synthetic source of, say, a vitamin A, a vitamin E, magnesium, selenium, lycopene. These are things that are present in the foods that we eat. But for some reason that is not entirely clear, our body does not utilize to the maximum benefit of the nutritional impact of each of those individual components the same way that it does if you eat them and they are combined with other nutrients for you to absorb. I mean, you're talking about Akea as being, fermented nutritional components and sources of nutrition that are from fruits and vegetables. That makes all the difference in the world because those components are absorbed. Let me explain it like this. When you make a meal, if you're going to make a stew, you can take potato, and you can take carrot, and you can take onions, and you can take celery, and you can take chicken stock. You take all those and taste them individually. Those are all good things, but they don't become a stew or a meal or a complete preparation until they are all put together and seasoned. And that's what you are getting nutritionally when you eat something that is a fruit or vegetable, is getting the whole food, because there are other agents, there are other chemicals and nutrients that are combined that when they work together, when you eat them and absorb them, that the benefit of that nutrition is totally different than eating each one thing at a time. I mean, you can eat a potato, you like potato, you can eat this, you like this, you can eat carrot, you like carrot, but somehow when they're combined, they taste different, and they taste different to your body. They are utilized differently physiologically. They're metabolized differently, and obviously more beneficially, because every single, I'll back up, there are conflicting research on various things, but the vast majority of the studies that have come out positive results show that eating things in the original package, or those components that are all combined together, make a difference in how beneficial they are. And that's what Akea Essentials offers. I mean, I've been utilizing it for solely that purpose myself now since it's become available. Prior to that, I did the best that I could on some other products. I don't eat 5 to 7 or 7 to 9 fruits and vegetables a day. I'm too busy being a doctor and doing other things. Everybody has an excuse. To me, it's the closest thing that you can do to meeting the recommendations and obtaining the potential benefit of the nutrition of the fruits and vegetables, which is not only good for helping eliminate or reduce your risk of chronic diseases, debilitating diseases, diabetes, hypertension, obesity, than you can get on your own. It takes a lot of effort to try and put all of that together on your own on a daily basis, and it makes a huge difference, and that's certainly been proven.
Dr. Koltis, in your experience, one last question here, and I really appreciate your time tonight. I mean, this is fantastic. One question I get a lot is, what kind of an edge do you think Essentials delivers because it's fermented or cultured foods versus, isolated nutrients like we were just talking about? I mean, how important is the consumption of those fermented foods for people's good health, or absorption factor, I should say?
Well, I mean, I think it's certainly clear that nothing is any use to you nutritionally if it's not made bioavailable, if it doesn't get into your blood, if it's not absorbed. Those products, while undergoing digestion, those nutrients, are fermented, and that's how they are absorbed in their best form to be able to make them bioavailable, to make them nutritionally important, nutritionally accessible to the body. And we're not talking about getting something in your stomach or in your intestine. We're talking about getting something from inside your stomach and your intestine to inside your bloodstream and then inside your cells. That fermented nutrient is a critical component to making it absorbable, which means it makes it bioavailable, meaning it makes it available in your bloodstream so it's accessible by your cells to be able to metabolize it and process it. So that's an incredible edge to have that as one of the features of Akea Essentials, is the fact that these are fermented nutrients. Then you absorb them, then you can use them.
I'm sorry. I think that's just fascinating. As I said earlier, I worked a long time in the nutrition business, and it would always make me mad when I would meet someone and they'd say, "Well, that's just high-priced urine." And I used to try to spend the next 30 minutes explaining why it wasn't. And then I learned about fermented foods, and I learned about the absorption factor being involved, and it just changed everything for me. And I found that I could no longer do what I used to do. I couldn't go around and talk about isolated nutrients and synthetic vitamins. And so I'm just happy that we have you. I mean, I can't tell you how much I appreciate you. Any last thing you'd like to add to before we close it out tonight? I can tell you right now, this is going to be one of the most requested calls. Get ready for us to ask you back. But anything you'd like to just add in closing?
Well, I just think it's important for whoever's listening to to again remember the concept of things as being best in the original package, and you should still eat fruits and vegetables in substantial quantities a day, unless you are capable of doing what 99% of the people I run into, patients or not, myself included. I can't meet that recommendation because my lifestyle just doesn't allow me to do so. This is the single best way to come as close to that, eating the real fruits and vegetables, as you can get. I still eat fruits and vegetables. I always add to that for a level of certainty by using Akea Essentials, every day. And there's a lot to be said for the fact, again, that this is, and people will say, well, why is this not FDA approved? This is not a chemical that was synthesized. This is not a drug. This is not a genetically altered something that needs to be approved or looked at or scrutinized. The FDA doesn't approve broccoli. These are food products, and how great that is to be able to get that much value from a food product that's not isolated, pulled apart into its components, but all components are still in that same stew, which is the way that our nutritional benefit from eating is actually utilized by the body. The whole product taken in combination with all the other chemicals and nutrients that are there together. That is what makes a critical difference. And that's why I'm confident that this is the closest we can come to doing the right thing for ourselves and our friends.
Well, again, Dr. Koltis, I can't thank you enough. I know that you're a busy guy. You're being pulled in a lot of different directions, and any time that we can gain access to your knowledge and experience is just an incredible opportunity for all of us. So I just want to say on behalf of everyone at Akea, thank you so much. It's been a terrific call. I can't wait to have you on again, and you know, just thank you so much for all that you do and being part of Akea.
It's been my pleasure. Thank you.
Okay, thanks, Dr. Koltis. Well, everyone, there you have it. Dr. Gordon Koltis, a member of our Science Advisory Board here at Akea. The gentleman has many, many years, seen thousands and thousands of patients, suffering and battling cancer, and telling you that this is the closest thing you can do, as he says, to the real package. So, guys, I want to thank you for all being on here. This call is being recorded and will be on the website within the next 24 hours. I just want to say thank you to everybody out there. I look forward to seeing you in your Counter City very soon. Have a wonderful night, everyone.